Rich, and yeah, I'll put the gift aid link in the chat afterwards. Any donations, cards, greetings, gratefully received. But no, great to spend my birthday, share it with you, everyone here, and thank you for the invitation, and the contributions so far have been excellent. And hopefully what I'll present to you all can build on that and can provide us with a platform for discussion at the end of the session. So yeah, I'm Rossman. I'm the director of the Health Services Management Centre here at the University of Birmingham. Collaboration, integration of services and care is a key sort of ethos, a theme that runs through our work. And from my own personal perspective, it's something that I've been involved in from a research and education capacity for quite a few years. So what I'd like to do now is provide you with an overview of some recent research that we've completed that hopefully builds on, complements the work of Kaleidoscope and many others in thinking about how to get the most from collaboration. So I'll briefly present some slides to you if that's okay with you all. So yeah, next slide, please. As a quick don of the cap hat to our funder, acknowledgement of the NIHR and the team that's involved in this research. And there is the final report that was published last year, and there's various links to that. It's open access. So thank you. Next slide. So let's get to the crux here. George kindly sent through the brief, and I was given the task around getting the most out of collaboration, and where does that take us? And I think this hopefully complements, builds on what's previously said. Our research interviewed service leaders, policymakers, workforce. We had patient public focus groups, and in developing that sort of detail and thinking about the concrete of collaboration, we identified a variety of different contributions, that this idea of working across boundaries, joint working, what that can bring. So here's a flavour of what we found. Collaboration makes a difference in the ability to create spaces. It creates spaces for communication. And through that communication, we can generate learning and shared understanding about our worlds of work and our experiences. And through that, and perhaps building on what Adam's just previously said, the communication and learning can open us all up for all the partners involved to exposure to methods and ideas about how we can improve services and how we can improve the experience for those involved. So there's a thread there with the communication, the learning, and the improvement, that sort of cycle there. There's also a factor to bring into collaboration, which is about why do we want to get involved if we maybe don't need to, but there's something about the reputation, the ability of collaboration to enhance the reputation of all those parties involved. And that might be useful in terms of a landscape where we're looking to work across internal and external stakeholders. The role of reputation management is something that might be useful for us when we're thinking about developing and nurturing collaboration. Next slide, please. Some of these quotes and reflections on these slides really talk to some of the kind of crux, the concrete foundations of collaboration, what it can bring. It brings oversight, coordination, and from that, what does coordination, oversight give us? It gives us opportunities to think about duplication. It gives us opportunity to think about economies of scale. And I think one of the points that our research brings out is the opportunity to think about scale, effort, and thinking about how we can support those, delivering at the front line, the workforce element of supporting duplication of effort and reduction in costs and economies of scale around workforce development. So I think there's some of the key concrete elements of collaboration that really map on what previously been discussed. Next slide, please. This slide is my final take-home message around successful collaboration. And again, it's that if we're going into this cycle of what the joint working, we're looking across boundaries, exposing ourselves to shared understanding, it creates opportunities to improve our services, stating the obvious, but crucially what collaboration can do, it can get us closer. Can get us closer to those that we are looking to serve, populations, communities, but it can get closer to our colleagues and our workforce and our teams. It's those dynamics and the ripple effects of working together that can create create the benefits for all. So I think that's something that maybe we could explore further. Last point from my own perspective here is thinking through the practical next steps for collaboration. So we've had this making a difference. What are the next steps? From our research, we've got the three sort of pillars or domains about the need to build trust, key thing that's come out of the session so far. And on this slide, we've got some different dynamics and things to think about in building trust, the narrative, the shared vision, the ability to think about quick wins. So the key part of thinking about complexity, the many moving parts, is to think about scale, think about how we can work at scale to communicate to others that this collaboration is progressing and working well. That connects into this idea of building faith or belief in a collaboration. To sustain this work, as Adam has previously pointed out, that requires energy and effort. So it's creating conditions where we are sustaining motivation and thinking about how we can communicate to others that this is progressing and we should continue in working with others and working across boundaries. The last kind of domain of this research was about building confidence, and that's certainly in mandated environments. That I noticed mandated was on the Mendy visual. In those dynamics, it's about contractual arrangements, acknowledging power dynamics and inequalities within those power dynamics. And then it's something about when we're in those contexts, how can we think about and better understand where our various partners and others are coming from? So that's about due diligence. And that's also thinking about accountability in terms of how we're going to enter into a collaboration and how we can, again, going back to this point about progress and belief, how we can ensure that accountabilities are built in along the collaboration journey. So I think that concludes my slides hopefully in around 5 minutes. There's a variety of other outputs from this research. So yeah, please do contact if you'd like any further information. So thank you.